Knock, knock.
Come in.
Hi, my name's Ashley. I'm going to be your nurse today.
Hello.
Can you tell me your name and date of birth, please?
Mike, 12/1/86.
Alright, I'm going to verify your name and date of birth and MRN number on your ID band. Do you have any allergies, Mike?
Not that I know of, no.
Good. Is it okay if I call you Mike?
Yes.
Very good. So I'm here today because I'm going to do a head-to-toe assessment on you, if that's okay.
Yes.
Good. I'm going to go ahead and close the curtain to provide for some privacy. And then I'm going to just do a couple of safety checks here. I want to just double check your IV line. I see that there's no swelling, no edema. Looks like it's working. Are you having any pain at the site? No? Alright, good. And I'm going to follow the tubing here and just make sure that everything is connected. There's no kinks in the tubing. And I just want to make sure that you are alert and oriented. Do you know where you're at right now?
The hospital, TGH,
Perfect. And do you know what today's date is?
the 28th.
Alright, very good. So he is alert and oriented to person, place, and time. And then I'm just going to look at you overall, and I see that your body is symmetrical. And then I'm just going to go ahead and start with the head-to-toe assessment. So I'm going to start up here at your head. I'm just going to feel your head here. I don't feel any lumps or bumps. And then I'm just going to take a look in your ears. Do you mind looking that way for me? Alright, I don't see any drainage or bumps. Check this ear too. Looks really good. And then if you could just look at me, I'm going to check your eyes. Very good. And then I see that your sclera is white and your conjunctiva is pink. If you can follow my pen. Alright, so your pupils are equal, round, reactive to light, and accommodation. I'm going to check under your nose here. I don't see any drainage or bumps. If you can open your mouth for me and say ah.
Ah.
Your mucous membranes are pink and moist. Your teeth are intact and your uvula is midline to the body. Very good. And then I'm just going to check your nails here. Your nails look good. They're well kept, trimmed. Very good. And then your hair looks really good and clean. Your scalp, I don't see any flakes. Your overall hygiene is very good. And then I'm just going to check your skin here. It's all warm and dry, which is exactly how we want it. Free of any laceration, scarring, bruising. I'm going to check your capillary refill. It is less than 3 seconds in both the hands and your feet. I'm also going to check your skin turgor here, which there's no tenting, so your hydration status is good. And then we're going to move on to, actually, can you smile for me? Good, your face is symmetrical, which is also what we want. We're going to check your respiratory. Are you having any issues breathing?
No.
Very good. Any chest pain?
No.
I don't see any use of any accessory muscles or signs of distress. So we're going to listen to your lung sounds using the Greek key pattern. If you don't mind, can you just sit up for me so I can take a quick listen to you? Alright, very good. And I'm going to lift your shirt up if that's okay.
Okay.
Alright. And then every time I move my stethoscope, I just need you to take a deep breath for me, okay?
Alright.
Alright, so we'll start. Very good. So your lung stones are clear to auscultation. You can go ahead and lay back down for me. And then if the patient was using an incentive spirometer, I would instruct him on how to use that. Now I'm going to take a listen to, or I'm going to check your cardiac system. So we're going to listen to your heart sounds and check some pulses. So I'm going to start with your carotid pulses here, one at a time. And those are +2 within normal limits. I'm going to feel your pulses here in both of your arms, your radial pulses, which are also +2 within normal limits. And then we'll check your dorsalis pedis, which is also +2 within normal limits. And then I'm going to also feel his point of maximal intensity, which is in the 5th intercostal space, midclavicular line, and I do not have any lifts or heaves. So now I'm going to listen to your carotids. And no bruise noted. And then we'll go ahead and listen to your heart sounds. I'm going to use both the diaphragm and the bell, okay? So I'm also going to lift under your shirt here to listen. All right, so I'm going to start a little higher with the aortic, which is right of the sternal border, 2nd intercostal space. And then the pulmonic is on left of the sternal border, 2nd intercostal space. And then the Erb's point, which is left of the intercostal space, 3rd intercostal space, left of the sternal border. And then we're going to go to the tricuspid, which is 4th intercostal space, left of the sternal border. And then the mitral, which is 5th intercostal space, left of the sternal border, midclavicular line. And all of those are within normal limits. And then I would also do it with the bell side. So aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, very good. So then we're going to move on to your gastrointestinal system. So have you had any nausea or vomiting lately?
Oh,
Any diarrhea?
no.
When was your last bowel movement?
Like 2 hours ago.
Okay, and it was normal for you?
Yes.
All right, very good. So now I'm just going to take a look at your belly, make sure it's symmetrical, it looks good. And then I'm going to listen to all 4 quadrants. If for some reason I were not to hear bowel sounds in any of the quadrants, I would listen to each quadrant for a full 5 minutes. So let's start. I'm going to first, I already looked, so now I'm going to listen. Go ahead and do this under 2, just to make sure. 1 full minute. And bowel sounds are normal active in all 4 quadrants. Now I'm just going to palpate your belly, okay? Let me know if you feel any pain or tenderness. I'm going to start with a light touch with each finger first, with 1 finger first. Any pain or tenderness? All right, very good. So now I'm going to do a little bit of a deeper push with 2 fingers, okay? No issues? All right, very good. All right, so now I'm going to move on to your urinary system. Have you been urinating any more frequently than normal?
No.
All right, how often are you peeing?
Every 3 hours.
Okay, very good. When was the last time you peed?
30 minutes ago.
Any pain when you're urinating?
No.
Okay, good. And then I would monitor the patient's intake and output. And then we're going to just talk about your musculoskeletal system. Have you noticed any swelling, numbness, or tingling in any of your extremities?
No.
Okay, very good. And then I'm just going to have you squeeze my hand so I can check your grips. All right. Grips are even bilaterally, and if you can just push against my hands. All right, very good. So your strength is equal bilaterally in both the upper and lower extremities. And then that pretty much concludes our assessment. So I'm just going to make sure that your call light is in reach. Are you familiar with how to use the call light?
Yes.
Can you show me how to call the nurse? All right, very good. And then I'm going to make sure that your bed is in the lowest position and that your side rails are up. And is there anything else I can do for you before I go?
No.
All right, so I'm just going to wash my hands and that's it.